2540, which is the Community College Student Right to Access Act. And first, I want to start by thanking the committee staff for their hard work and partnership with my office, as well as the community colleges for their thoughtful engagement throughout this process. And I will be accepting the amendments we have agreed to, which will be taken in the next committee. So thank you so much for that. 4 years ago today, the United States Supreme Court overturned Roe v. Wade. With one decision, the court stripped away a constitutional right that millions of Americans had relied on for nearly half a century. It was a devastating step backward for reproductive freedom. California responded by reaffirming our commitment to reproductive health care. California has long said that access to care should not depend on who you are, where you live, or how much money you have. But today, that is exactly what happens for many college students in our state. Imagine two students living in the same community. One attends a UC or a CSU, the other attends a community college. Both are working towards a degree. Both may be balancing jobs, family responsibilities, and the pressures of school. Both need access to reproductive health care. But only the student at the UC or CSU is guaranteed access to medication abortion services through their campus health system. The other student at the community college may have to navigate transportation barriers, take time off for work, find a provider miles away, which we've heard stories of, or simply go without care altogether. And the reality is, the student facing those barriers is often the student who can least afford them. Community college students are among the most diverse students in California. They are more likely to be low income, more likely to be first-generation college students, more likely to be working while attending school, and more likely to be balancing family and caregiving responsibilities. These students are doing everything we ask of them. They are pursuing an education, building a future, and strengthening our workforce. Yet when it comes to access to reproductive health care, we are not treating them the same as students attending four-year institutions. That disparity is what AB 2540 is solving for. This bill expands equitable access to medication abortion services for students attending community colleges by requiring colleges with existing student health centers to provide these services. And let me be clear, reproductive health care is essential health care. Access to that care should not depend on whether a student attends a UC, a CSU, or a community college. This bill allows services to be provided through existing campus health centers, through telehealth, through contracted providers, or community partnerships. It also improves transparency by requiring colleges to publish information about available services so students know where they can turn for care. I've said this before in every committee I've presented this bill in. Community college students are not second class. They deserve the same life-saving access to reproductive health care. And with me today in support is Alicia Nagpal, who is with the Student Senate for California Community Colleges, and Dr. Pana Lassi, a family medicine physician who has provided primary and abortion care for over 30 years.
Thank you. You will have a combined total of 5 minutes.
Good afternoon, Chair Weber Pearson and members of this committee. My name is Alicia Nagpal, and I sit here as the Vice President of Legislative Affairs for the Student Senate for the California Community Colleges, the official voice of 2.2 million students across California. I am also here not just as a student leader, but as someone personally impacted by reproductive health challenges. Our support for this bill is grounded in distribution of clear and comprehensive information for available reproductive and sexual health resources, which AB 2540 establishes. AB 2540 is an effort to provide equity when it comes to reproductive health care to some of our most vulnerable populations. While students at the UC and CSU campuses already have access to medicated abortion services through SB 24 in 2019, community college students do not. They are more likely to be low income, working, and place-bound. Students in remote areas, such as the far north, often don't have the same access to services that students in urban regions may have. Students who are struggling to make ends meet may not have reliable health care. With this discrepancy, students in the CCC system are disproportionately affected and cannot access timely reproductive health care. Instead, they may be forced to miss class, delay their education, or drop out entirely. Barriers to care become barriers to college completion. This matters most for the students who are already navigating the greatest challenges. Foster youth, undocumented students, students of color, and first-generation students who have the least margin of disruption in their lives. Access to these resources expands on the equity work that should be strived for in healthcare and in higher education. This bill ensures that students are well informed about services and how to access them. The bill means timely, affordable care. It means privacy, dignity, and autonomy when students seek support. And it affirms a simple truth. Community college students deserve the same standard of care as any other student in California. AB 2540 affirms a simple truth. Us community college students deserve the same standard of care. We respectfully urge your aye vote. Thank you.
Hello. Hi, my name is Dr. Panna Lassi, and I'm a family medicine physician who has provided primary care and abortion care for over 30 years. I'm also the very proud mother of a daughter who just finished a fabulous culinary program at our local community college. Many of my daughter's classmates and friends come from immigrant and low-income families and worked part-time or full-time while going to school. If we truly believe in reproductive freedom, justice, and equity in California, then we must pass this bill. I want to stress how safe early medication abortion is. A recent study in the journal Contraception shows that staying pregnant was 35 times deadlier than having an abortion. The major complication rate is less than 0.5%, and the mortality rate is 0.6 per 100,000 procedures. For comparison, the mortality rate for a colonoscopy is approximately 3 per 100,000 procedures, 5 times higher. I understand that the idea of providing medication abortion might feel daunting to people who have not been active in reproductive health care recently, but it is very doable. My family practice clinic started offering medication abortions in 2003, 23 years ago, so I have firsthand experience. I also helped Sonoma State implement medication abortion services after SB 24 and have consulted with many other clinics about adding abortion care to their practices. What has been universally true is that it feels scary before starting, but after implementation, providers reflect that it's really not medically or technically difficult at all. Routine ultrasounds and follow-ups are no longer required, and if providers have questions, they can call the California state-funded UCSF Reproductive Health Hotline for immediate free help. There are also free on-call services to help patients after hours. The benefit to students is enormous by not having to delay care and interrupt their studies because they can get what they need from trusted providers right on campus. I know that everyone working in the community college system is committed to providing the best education and health care to their students, and I strongly encourage a yes vote on AB 2540. Thank you very much.
Thank you. If there's anyone else in the audience that would like to register their support, please come forward, state your name, your organization, and your position.
Chair and members, Austin Webster with W Strategies on behalf of the Student Senate for California Community Colleges, also here just to answer questions.
Thank you.
Thank you, Chair and members. Angela Pontes on behalf of Planned Parenthood Affiliates of California in support.
Thank you.
Good afternoon. Angela Hill with the California Medical Association in support.
Thank you.
Lizzie Guansona here on behalf of Training in Early Abortion for Comprehensive Health Care, or TEACH, in support.
Thank you.
Good afternoon. Georgia Apostolides on behalf of Lieutenant Governor Eleni Kounalakis in support. Thank you.
Thank you.
Good afternoon. Adam Kegwin on behalf of California LULAC in support.
Thank you.
Christine Smith, Health Access California in support.
Thank you.
Martin Radosevich on behalf of Reproductive Freedom for All California, co-sponsors.
Thank you.
Good afternoon. Isela Bravo on behalf of URGE and California Latinas for Reproductive Justice, proud co-sponsors in support.
Thank you.
Hello, Alana Ladisar on behalf of the American Nurses Association of California in support.
Thank you.
Hi, Kim Robinson with Black Women for Wellness Action Project and also giving AME2 for Access Reproductive Health in support, and also co-sponsors.
Thank you. Seeing no one else that would like to register their support, if you would like to speak as lead opposition, this is your time to come to the table. Just 2 witnesses to speak as lead opposition. Thank you, and you both will have a combined total of 5 minutes.
Good afternoon, Chair and members. My name is Michelle Barkley, representing Health Services Association, California Community Colleges, HSA-CCC. We have an opposed position on the bill at this time, but anticipate removing opposition based on amendments discussed this week. To be clear, HSA-CCC strongly supports students' access to comprehensive reproductive health care, including abortion. We appreciate the author, committee sponsors, and the Chancellor's Office for the continued collaboration and thoughtful work on recent amendments on AB 2540. We especially value the added flexibility allowing colleges to partner with outside providers. This is an important step that recognizes campuses may support students through a mix of on-site services, telehealth, and community partnerships. We want to highlight a few practical considerations. Each model brings different operational needs. On-site care may require new clinical staffing and infrastructure. Telehealth still relies on campus coordination and oversight. Community partnerships can be effective, but provider availability varies widely by the region. Community college health centers are already operating at or near capacity and are designed for short-term care, implementing multiple service pathways simultaneously, will take careful planning and support. Sustainable ongoing funding will be essential to ensure colleges can expand access while maintaining core services students depend on. HSA-CCC is committed to continuing to work collaboratively with the authors and stakeholders to help ensure this bill is both student-centered and implementable. Thank you for your consideration.
Thank you.
Members, my name is Megan Pannell, and I am a current community college student at Folsom Lake College. I'm here today in opposition of AB 2540, which promotes and expands access to abortion drugs on community college campuses. While I have never been pregnant, nor do I have any children of my own, I have worked in public education and watched friends juggle school and parenthood. The stress of going to school for a degree alone is a lot, and to be able to handle that while also being a parent is something I have always admired in others. It shows how strong people can be while also showing their children that nothing is impossible. Instead of promoting abortion and choosing to end a life out of convenience, we should be giving college students resources to help them. For example, providing them with options for adoption if they choose they aren't ready to be a parent, offering child care centers on campus so that they can attend class while their child is well cared for. My mother was sexually assaulted at a young age and got pregnant with me. Rather than telling someone, she chose to hide her pregnancy because she wanted to give me the ultimate gift of life. She knew there was a chance that someone would try to pressure her into abortion. She is my inspiration to fight for the millions of beautiful children who have no voice. Time or circumstance should not dictate the value of life. Did I deserve to die for the crimes of my father? California does not impose capital punishment. If we do not punish criminals with death, why should an innocent child receive a death sentence because of the circumstances of his or her conception? Why are we so quick to end a life out of convenience instead of offering resources for the mother and her child? Young women with unplanned pregnancies should be encouraged to have their children instead of making abortion an option women feel pressured into, because that's the only option offered for an unplanned pregnancy. From someone who is happy to be alive, I respectfully urge a no vote on AB 2540.
Thank you. If there's anyone else in the audience that would like to register their opposition, please come and state your name, your organization, and your position only.
Good afternoon, David Bollig on behalf of the SFV Alliance. We are in opposition. Thank you.
My name's Leandra Wells with the California Family Council. I completed my degree 3 weeks after my baby boy was born. We respectfully oppose this bill. Thank you.
Thank you.
James Delcor, Living Well Medical Clinic, Grass Valley, stand opposed.
Thank you.
Good afternoon, Justin Selmick on behalf of the California Community College Chancellor's Office. We don't have an official position, but we are supportive of the intent, and we are aligned with the concerns of the Health Services Association and the community college CEOs. But as our witness spoke, there have been amendments that are pending that will hopefully remove our concerns going forward.
Thank you. Seeing no further individuals that would like to register their opposition, support, or tween position, we'll bring it back to the committee. Okay. I want to thank Assemblymember Stefani for bringing this bill forward. It is extremely important that we, as a reproductive state, a state that believes in allowing for people to have all options of what they want to do with their bodies, that we do work on getting this right. Also understanding, though, the challenges of our community colleges. Community colleges are not UCs, they're not CSUs, they don't have the same resources, and not all community colleges are the same. Some are very large, and some are very, very small and are very limited in terms of resources. And I think sometimes when people think, oh, well, you can do telehealth, and they've never actually done telehealth, they don't understand some of the intricacies and some of the modernization that you must have, the infrastructure that you must have in order to be able to do something like a telehealth. And so I really appreciate you agreeing to these amendments. I think that it does address a lot of the opposition's concerns, but at the same time still allowing for disclosure on all campuses about what options are available, and also allowing for those community colleges that do have the ability to do this to continue or to provide this service for the students. And with that, you may close.
Thank you, Madam Chair. And yes, I do want to thank the community colleges for working with us on this bill. This is not to add any burdens to their already overstressed system. We want to make sure that we are working with them, and that's why we have accepted the amendments and will continue to work and address those remaining concerns. But, you know, this bill is about equity, it's about dignity, it's about making certain that we have reproductive health care access to all those students who need it. And I thank you for your consideration. I respectfully ask for an aye vote.
Thank you, and at the appropriate time, whenever we establish quorum, we will do that. All right, we will now move to file item 8,